Mr. Saktiandi Supat.
Mr. Speaker, sir, may I have your permission to take questions 6 and 7 together?
Please do.
Thank you, sir. My response will also cover the matters raised in the written question 4933 by Ms. Joan Pereira. Sir, since the transition to DORSCON Green in February 2023, all COVID-19 measures have been stepped down, with the exception of the National Vaccination Program, the NVP, which serves as our first line of defense against the fast-mutating COVID-19 virus. However, we've also adjusted our normal practices, such as requiring mask wearing in patient-facing settings, to better protect patients and healthcare workers from respiratory infectious diseases in general, not just for COVID-19. MOH will continue to monitor the broader communicable disease situation, review our disease control practices, and adjust our approach. New COVID-19 variants will continue to emerge. The latest variants of interest are EG.5 and BA.2.86, which have a number of additional mutations compared with previous Omicron variants. Fortunately, so far, the science and the empirical evidence show that existing vaccines continue to provide good protection against severe illness for individuals. The pharmaceutical industry continues to update COVID-19 vaccines to preserve the effectiveness against new variants. For example, Pfizer's latest vaccine specifically targets XBB.1.5. Our contracts with suppliers enable us to procure the latest vaccines once they are assessed to be appropriate for the local situation. Recently, HSA has approved the monovalent XBB.1.5 vaccine from Pfizer for patients aged 6 months and above, and are reviewing other XBB.1.5 vaccines. The Expert Committee on COVID-19 Vaccinations is currently reviewing the data of the updated Comirnaty vaccine and will be providing its recommendations. The updated Comirnaty vaccine could arrive in Singapore by end October. We will share more details when operational arrangements are confirmed. We were able to achieve DORSCON Green not because COVID-19 became a mild disease. It's still a dangerous virus, especially for all vulnerable individuals and seniors. We can live with the virus now because our resilience has strengthened due to vaccinations and safe recovery from infections. It's therefore important for us to maintain our resilience. That's why MOH strongly recommends that seniors aged 60 years and above, as well as residents living in aged care facilities, and medically vulnerable persons continue to receive a booster dose of the updated vaccine 1 year after their last booster dose. Healthy persons aged 12 to 59 years may also receive the additional dose in 2023, which remains free under the NVP, if they choose to. There are no plans to charge for COVID-19 vaccines because vaccines still play a critical role in keeping COVID-19 at bay. Thank you, sir.
Mr. Saktiandi Supat.
Mr. Speaker, I'd like to thank SMS for his answer. Just one SQ. May I ask SMS what is the long-term COVID exit strategy for Singapore? And have we attained herd immunity such that continued vaccination will be optional from now on? I'm glad to hear that SMS mentioned that there's no plans to charge booster shots going forward. And those from age 12 to 59 would still be advised to take their vaccines. Thank you.
SMS Janil.
The COVID-19 situation is quite dynamic. The virus mutates. What it does is still changing. So there is really insufficient data to commit to a long-term vaccination strategy at this time. MOH will continue to monitor the situation closely. We'll take into account expert advice, the latest evidence, and we'll update our recommendations on the basis of those as needed.
Dr. Lim Wee Kiang.
Mr. Speaker, sir, thank you. I'd like to ask the SMS whether, in his opinion, is there a vaccination fatigue now going on? Whether vaccination rate is dropping, partly because people are feeling that it is much safer now and then they also for fear of side effects of vaccinations. So what is the strategy by MOH on this to deal with this vaccine fatigue? And then is there a long-term plan like what you just mentioned?
SMS Janil.
So I thank Dr. Lim for his very important question. The core of the strategy is educating the public, engaging them on their fears and concerns, and explaining to them the importance of vaccination. And not just for COVID-19, but for many other diseases. Vaccination works. And it is an important part of how we defend ourselves against infectious diseases. We will continue to provide public health education material, engage the public on their fears and concerns, and we hope that the members of this House will help us in doing so.